My purpose in life really is to take care of people without the regard for the ability to pay for the care that they receive. To have the ability to actually change people's lives. It's always been the case. My name is Gbenga Ogedegbe. I am an internist, a professor of medicine and population health. I am the founding director of the Institute for Excellence in Health Equity at NYU Langone Health. I am the founding director of the Center for Research in Health in Africa. Just imagine, as we speak now, every 7 seconds, somebody just had a stroke somewhere in Africa. The purpose of CAReH Africa is to actually address the 3 major factors that drive poor health in Africa today. 1 is the acute shortage of healthcare workers. 2 is the uncoordinated nature of the healthcare systems that we have. And 3 really is that we have a huge burden of disease, but don't have enough workforce to address it. So I founded this initiative that's called the Center to Advance Research in Health in Africa. And the mission of that organization is really to actually leverage our human resources to build capacity to address the burden of disease in Africa. With that frame of mind, my research focus was to look at ways to address the burden of high blood pressure or hypertension in low-income, minoritized populations. And so what does that mean? I'd love to train people on the continent to do research and to stay back on the continent. We've got to be more proactive in training people to begin to appreciate the power of the human resources that we have on the African continent. 1 billion people, 300 million in West Africa. We have enough non-physician workers. Why aren't we deploying them? Why aren't we integrating what I call a community clinic linkage model that allows us to address the social determinants of health while linking people to care? So I think that's a game changer. So the area of my research was asking a very simple question. Why is it that Black folks have a higher burden of hypertension compared to white folks? What are the factors that drive that? How can we develop strategies to actually narrow that gap in mortality between Black folks and white folks? When you look at healthcare in a country like Nigeria and other low-income countries, what you find is that the majority of the factors that drive poor health in these countries are driven by what we call the social determinants of health. So the social determinants of health are the conditions in which people live, in which they play, in which they walk, in which they pray or worship. Those conditions explain at least 80% of the poor health that people have today. So let me share some numbers with you. Africa has 14% of the burden of chronic diseases. This is data from 2008. But they only have 3% of the workforce. So the question then becomes, how do we address that? So my mother, at the age of 85, died of a massive stroke. When she had the stroke, it took her 45 minutes to get from her house to the hospital. This is in Lagos, Nigeria, a metropolitan city. So if it took my mother 45 minutes, a woman with means, to get to the hospital, you can only imagine how much barrier low-income people face in such settings. CAReH Africa is focused on not just driving innovation around how we leverage the human capacity of our non-physician health workers to deliver tasks that primary care physicians will ordinarily deliver. We're not only training nurses to deliver healthcare, but an important aspect is also focusing on how we can actually increase the ability and the capacity of African scientists to conduct research that is relevant to the care they have to provide to their own communities.
The main thing we've been doing is building research opportunities and capacity among our future research leaders in Nigeria, and to ensure appropriate networking and collaboration opportunities for this same set of people so that we can take research in Nigeria to the next levels.
Oh, by the way, research is a major way to have discovery and innovation. The research that is conducted on the continent of Africa increased from 1% in 2002 to 2% in 2012. The National Institute of Health gets probably $34 billion annual budget, with only about 100 million of those invested in Africa and other low-income countries. When you look at that number and you look at the burden of disease, you begin to say to yourself, the amount of research that is conducted on the continent, it's not going to be enough for us to have the discovery that's necessary to actually advance healthcare on the continent. So what's CAReH Africa doing about this? We're beginning to train scientists in Ghana and Nigeria to actually conduct research in their lived environment. So this is it. This is the house. This is where we grew up. I don't think much has changed. So nice to be back home again. So I grew up in Yaba. So growing up there was like the melting pot, actually, of Lagos. All the action, all the clubs, all the artists, were all in Yaba. So growing up there was very vibrant. Gave a different kind of energy. I remember there used to be the Bobby Benson, Sonny Ade, Obemileke Sport. We were all about maybe 200 meters from my house, and we had the Ambassador Hotel. Of course, I was too young to appreciate those things, but I remember very vividly what life was like at the time. We had the Suya Sport or Aria nightclub, led by Sonny Ade at the time. Those are top musicians, Tos Benson. So it was a really good time. But I went to school in Yaba as well. I went to elementary school, one of the oldest primary schools in Lagos called Ladulak Institute. And it was quite an experience. I was a bit early when I started school, probably 5 years old. Finished my elementary school and my parents decided I had to go to Warri. We all spoke Shekiri, we spoke Yoruba as well. And I had to go to Warri, which is, in the South. That's where we're from. My dad was Shekiri. So I went to Hossey College, Warri. Hope or say that's one of the top private schools in the Midwest at the time. There was Hossey College, there was Edo, then there was Irubu College. I spent 5 years in high school and then came back to Lagos after boarding school to do we'll call it advanced levels at the time, St. Gregory's College, Lagos. So I had a really good feel for what life could be like. things actually changed the trajectory of my life as I know it today. The very first one was, I was 8 years old and I was sliding down the staircase and I fell down on a bottle of Coca-Cola. Probably 8 years old, sliding down this staircase like that and then fell off on the side. So of course, I had a major gash in my foot. So my mom rushed me to the hospital. I think she took me to Luth, Lagos University Teaching Hospital. And I'm sitting there in pain. Of course, I was also afraid. My mom had to take her out of her comfort zone to take me to the hospital. That's like a major no-no, right? And the doctor came in and said, "Gbenga Ogedegbe." And I looked at him. White coat, glasses. That's when I knew I wanted to be a doctor. This is the mailbox where I received my telegram to come for an interview for the United Nations Scholarship. Same mailbox, it hasn't changed. So this is it. This is the backyard. Not much has changed. That's where you fetch the water. You can see over there. There's a borehole that we get water from. My memory of this place is that everybody was the same kind of people. And this is the kitchen. So this is a very important piece. Right here. So right here is where we actually cook the food for the whole family, right? Probably about 20 of us. But the striking part about this kitchen is if you come in, just take a look a little bit. See, the walls are very dark. It's dark because we use kerosene to cook. So you talk about household air pollution. This is the clear example of that. I don't know how we did it because it's been well documented that household air pollution does affect cognition. So currently in Lagos State, Nigeria, we're working in 34 communities. These are low-income communities to actually reduce the use of fossil fuel or kerosene. That is the major cause of household air pollution, the major cause of pneumonia in children, or what we call lung disease. What we're doing is using clean fuel, helping the community to adopt the use of clean fuel to actually reduce household air pollution, thereby reducing, if you think about it, heart disease. The value of CAReH Africa can be captured by this saying: people don't care what you know until they know that you care. That means that the communities that we serve, for them to actually know that we care for them, we've got to have the following values: compassion, equity, access, integrity, and trust. Those 5 values encompasses what CAReH Africa stands for. So in caring for the communities, the people that we train to deliver care, we've got to have a good sense of where they're coming from. We've got to earn their trust. And this is how we've been able to actually deliver the task-shifting strategies in Nigeria and Ghana. What that then does is it allows the patient to appreciate that you actually care for them because you have a deep understanding of the conditions that make it difficult for them to engage in healthful behaviors, for them to come to clinic to receive care, for them to actually carry out those tasks that we're asking them to carry out. So it's very important for us in CAReH Africa to have the ability to incorporate, to integrate, to infuse all of these values into the training that we provide. The reason you're all doctors is not so much because you have to be educated. We all do, right? It's because people out there where we just came from today, somebody has to take care of them, right? It's population health. It's important. Somebody has to do it. It doesn't matter how you think. The reason you're in medical school is not because you want to make money. The money will come. There's no question. But somebody has to do that health work. And that is the most important thing. You know why I say that? Maybe not some of you, but when I'm sitting there in that market today, I see my mother in everybody. Am I making sense? I see my aunts, I see some of my cousins. That little baby that was being breastfed, I was talking to Prof that could be the next doctor that we ever have in this area. Some of us were raised like that, actually. So it's important. So you're going to ask, why did you leave? Well, I'm back. Fully, strongly, and doing very important work in this place and in Ghana. So I want you all to think about, what is your purpose? Where do you belong?